If you are studying to become a registered nurse, or you are a nurse but then you are thinking of switching into a home health nurse, or still if you are someone who is just curious to know who a home health nurse is and what a home health nurse does, then this video is for you. Imagine a trained, compassionate healthcare professional standing right in front of your doorstep with the aim of providing you with adequate healthcare services in the comfort of your home. Isn't that amazing? Hi everyone, welcome to Diabetes Mindful Talks. I'm Ira Bikono, a registered nurse and a certified diabetes educator. As you might have seen from the title, today I will be talking about nursing, and to be more specific, home health nursing. By the way, I practice as a home health nurse. I will be talking on who a home health nurse is and what a home health nurse does. Before we dive into the video, if this is your first time watching my videos and you like content like this, please make sure to subscribe to the channel and also give this video a thumbs up. A home health nurse is also considered as a registered nurse or a licensed practice nurse. So a home nurse is basically someone who takes care of patients in the comfort of their homes. It means that you have to take care of acute patients and chronic patients. Acute patient, for example, is like patients who have been discharged from an operation and is back home to recover. And then for a chronic patient, you have maybe people like they are in their palliative state. So with home health nurse, you get to take care of chronic patients and acute patients. To become a home nurse, you normally have to study and obtain a diploma or a certificate depending on the country in which you are. For example, if you are in Belgium, there are two major ways to study and become a registered nurse. The first way is to study as a Bachelor of Science in Nursing, or you study through the HBO5. Now, let me explain the difference between these two. So, to study as a Bachelor of Science in Nursing, it means that you have to follow a 4-year program, and this is a combination of your theoretical and your practical experiences. For a bachelor's program, you can definitely follow it in the university or in a high school. And then we have the HBO5, which is known as the HBO5. The HBO5 is normally a shorter version, which means that you are required to study for 3 years. It is practically like a vocational school. You can also study it in your high school level, so you don't actually need to go to a university to study the HBO5. And these 3 years includes your theory and your practical. In the HBO5, you study in a modular system, which means that you have 1 month less and you have 1 month practical. So with the HBO5, you are more used to the work floor more than the bachelor's program, because people that study the bachelor program, they get more theory than more practical. Now that we have seen who a home health nurse is, let us look at what a home health nurse does. From personal care to medication to palliative, that we will be discussing in this video. But then, if by any means I forget to mention something that you already know, please do not hesitate to drop it in the comment section. To begin with, we will start with hygiene care or personal care. As a home health nurse, it is your job to take care of a patient at home, to see that they are kept clean, that they take their shower, they dress properly. Some of these patients, they cannot do it, but some can do it, but they just need somebody to be there to guide them. Maybe because they are scared that if they enter the bathroom, they can slip and fall or something like that. Some of them just need security. It's not actually that they cannot do it, but they just need somebody that will be there to care for them in case they fall. But there are also some people that cannot take care of themselves. So as a home health nurse, it is your duty to help or assist them in taking their baths. Home health nurse is also responsible for the patient's medication. As a home health nurse, you have the duty of setting their medications ready. For some patients, it might require you to set their medication for a whole week, while for others, you might just give them their medications daily. They are not capable of taking their medications correctly, so they need somebody to be there with them to ensure that they take their medications correctly. But for some people, because they are not fit to put their medications, so you are required as a home nurse to put their medications weekly. You have to put their daily dosage, for instance, their morning dosage, their afternoon and their evening dosage. You have to put everything for them ready. Then the only thing for them to do is to take their medications at the appropriate time. But but also there are some of them that are not even capable of taking the medications at the appropriate time, which means that it is your duty as a home health nurse to set the medications ready for the whole week, and then at every given time of the day, you are responsible to come to their homes and give them this medication. For instance, if they have to take their medications at 8 a.m., then you are responsible to be there at 8 a.m. to give them this medication. At 12 o'clock, you are also responsible to be there at 12 noon to give them the medication. Just like that until they take their daily dosage. So for some patients, you might be required to be there maybe 3 to 4 times to ensure that they take their medications as prescribed by the doctors. A home health nurse is not only responsible for oral medication, but a home health nurse also administers injections like intramuscular or subcutaneous injections. Depending on the company or the agency that you are working with, some companies, they have special teams that are responsible for the IVs and blood samples. Another thing that the home health nurse does is to measure the vital parameters of the patients like blood pressure, their sugar level, their saturation or their oxygen level, their pain score, their weight. These are all vital parameters that have to be measured by a home health nurse. Next up is wound care. Home health nurse also treat from simple to complex wounds and ensure that these wounds are free from infection. It is also the duty of a home health nurse to evaluate the healing process. For example, if the home health nurse realizes that a wound is not responding to treatment, it is the duty of the home health nurse to inform a wound specialist to bring up another wound treatment plan. Home health nurses also do take care of palliative patients. There are some patients that will prefer to die in the comfort of their homes than to die in the hospital. So these patients are brought back home, and then we as home health nurses are required to give these patients maximum care. The main care that we are required to give here is just to give this patient a comfortable care to see that their end is painless.